Hi everyone, in this video I'm going to explain 10 things that every man should be aware of before they start TRT or testosterone replacement therapy. My name is Dr. Mazhar. I run a men's medical clinic in Leeds and we serve patients all over the UK, and I've done hundreds of prescriptions for testosterone therapy, seen lots of positives, lots of issues and troubleshooting that comes up as well. And a lot of expectations and different patient experiences. So these are 10 things that I now discuss with every patient before they come under my care and start testosterone therapy. So, number one, TRT is not guaranteed to be life-changing or give you lots and lots of energy. So on forums, on YouTube videos, you will hear a lot about testosterone therapy, and some patients will say the improvements can be drastic or life-changing. Absolutely, this is the case, and some patients can experience that. However, the vast majority of patients will not describe TRT as life-changing. So I always labour on this point for patients to manage expectations and to ensure that they are not expecting too much from TRT. The majority of patients will, on average, feel better than what they did before TRT. Some patients will say that I feel like I've got my old self back again. And a few patients, I've had one patient who said, I can now stay up in the evenings to watch a film with my wife. So a lot of it is more modest improvements in your symptoms and energy, and it's important that every patient is aware of that. You may be lucky and it may be life-changing, but that is not the typical patient. So number two, lifestyle matters on testosterone therapy. So if, for example, you're smoking, you drink lots of alcohol, you don't exercise, you're gaining weight, and you go on testosterone therapy, in all likelihood, you're going to get side effects and probably come off it, or it's not going to do much for you in terms of positive benefits. So you need to make sure you're lifting some weights a few times a week. It doesn't have to be at the gym. It can be home workouts or some kettlebells. You have to make sure that you do a little bit of cardio, you keep your diet in check, and you limit any excess body fat, and you look after your nutrition. Because in the long term, the patients who do that will end up doing much better on testosterone therapy. Now, there's a caveat, and the caveat is if you have low testosterone, you may not have the energy to work out in the first place. So if you can fix that, then TRT may give you the energy to work out. But it always has to be the goal to set the lifestyle changes as a foundation, and then testosterone therapy is just kind of the cherry on top. So number three, so we need to make sure that testosterone is actually the problem. So I've had a couple of patients where they've had one testosterone blood test, let's say 9 nanomoles per litre in the UK, and straight away they want to go into TRT. It's important that you get at least 2 samples done to confirm the first sample, because sometimes you can get big discrepancies based on sample being poor, based on different labs, based on how long it takes to reach the lab, or maybe you were unwell and your testosterone was low for just a few days. The other reason it's a good idea to get all these tests done is because we need to rule out other things such as iron issues, thyroid problems, sleep apnea, obvious stress or lifestyle issues before we go on to potentially lifelong hormone therapy. So it's important to know we have to look at other aspects, not just testosterone, and a full workup must be done before committing to hormone therapy. So number 4, there isn't one best form of TRT. Now, we do gels for some patients, we do creams for some patients, we do 2 or 3 monthly injections, and then we do short-acting injections such as testosterone cypionate or sustanon. If someone says there is only one best form of testosterone and all the others shouldn't be considered, it's incorrect. I have some patients in their 80s who do fantastic on testo gel. Just gives them a little bit of symptom control and doesn't take them too high. I've got some patients who do prefer the convenience of Nebido, even though it's probably not the most optimal form of TRT. But yes, the vast majority of patients are on short-acting injectables. And if a patient asks me which would you choose, I would say short-acting injectables. But I never say to patients that this is the best one for you. I give them the options and I let them make a decision. So number 5, your starting dosage of testosterone isn't necessarily what you're going to end up with. So if you start on, say, 100 milligrams a week, generally we would stay on that level unless you're having side effects and do a blood test at week 6, month 3, month 6, and so on. So based on your blood test results, based on your symptoms and how you feel, we can change the dosing of testosterone, either increase it or decrease it, or even change the frequency or type of testosterone. Now, there are some patients we will put them on a starting dose and they will just continue that for years, but they are the lucky patients. Most patients require some kind of adjustment or changing of the protocol at some point in the first 6 months, which is entirely normal. Point number 6, I've just got a few notes so I'll make sure I don't miss anything. So point number 6, so the honeymoon phase. So in the first couple of months or first few weeks, some patients will experience an increased surge in libido, motivation and energy. So we call this the honeymoon phase. And often they find that honeymoon phase may taper off and the benefits may not be as previous. So often what happens is if you're testosterone depleted and then suddenly we fix that problem, some patients can feel the benefits pretty soon after. And what happens is after a while, your TRT will taper off and you will reach a new normal. Now, when you reach a new normal, it may feel like you're not making that kind of weekly progress which you were doing before, which is absolutely fine. The body is not designed to continuously improve in energy, motivation, and libido. You will reach a new normal and changes will feel incremental or small. Or you may feel like you're not making any further progress. All that's happened is generally you've come out of the honeymoon phase and now you're on TRT for the long term. And there may be incremental changes, but they may happen over a period of months and years now, rather than over a period of weeks. So it's important to be aware that the first couple of months of TRT are not representative of the whole TRT journey. Point number 7, related to the previous point, is placebo effect. So sometimes I start TRT and within the first couple of weeks, patients experience a surge in energy, usually within the first injection or the first week or 2, and then they contact me and say it stopped working. Often what's happened is the testosterone expectations has given them a placebo effect and they feel benefits that were just placebo. And often what happens is if we continue testosterone and we change nothing, after a couple of months, they will start to get actual benefits of TRT. The other aspect of this is the nocebo effect. So if, for example, you've been reading about hair loss and you're very worried about your hair and very anxious about your hair, and you've done lots of research on it, and then you start TRT, you may start to convince yourself that you're losing hair, even if it's a normal amount of hair shedding or it's due to another reason such as stress. So this can work both ways, and once again, this is where a lot of the work that I do with patients in the first couple of months comes into it in terms of reassurance and managing expectations. Point number 8, I'll make this brief because this is a whole 1-hour video by itself, but TRT can affect fertility. You should be aware of this if you want to have children in the future or you want to keep your options open. Your doctor should discuss this with you before and ask about what your plans for fertility are. At the bare minimum, we recommend sperm banking, although a lot of patients may not end up doing that. But at bare minimum, we would recommend semen testing kits, so to monitor progress. And that way, if there is an issue with the sperm counts, we can identify it sooner rather than later. But fertility must be discussed and considered with the patient. Number 9, regular blood tests are part of your treatment. This doesn't happen that often, but every now and then I get patients who have busy lives and it's difficult for them to come in for blood tests, particularly in the first 6 months where we will end up doing free blood tests. But it's important, the blood tests are there to pick up on any early issues, such as estrogen problems, such as problems with bad cholesterol profile, or issues with the blood thickness or hematocrit. So the bloods are done for a reason. Now, if you've been on TRT for 6 months, we can then reduce that to 6 monthly blood tests. So even maybe once a year or twice a year, and just monitor things a bit more loosely. But in the first 6 months, those blood tests are very important to pick up any issues. and also make sure that your hormones are in approximately the right kind of threshold that they need to be in for you to feel better and to ensure that you're not getting symptoms. Point 10, TRT is usually a lifelong treatment therapy, but not always. So what I mean by that is if you feel good on TRT and you've got the benefits and then you decide to stop, generally you will slowly return back to your baseline and all your symptoms will return. So if it's working, you would expect to be on it for life. Now, if you want to come off testosterone, so for example, your circumstances have changed or you develop side effects, within the first 6 months, it's a lot easier to come off TRT. So you can stop it, and generally your natural production should kick back in within a couple of months, and you should be back to your baseline. So roughly whatever your testosterone started at, within a few months you should be back on that. Now, if you're on TRT for 9 years or 10 years, then obviously that process will take a lot longer. There are ways to manage that using medication off license, such as HCG or Clomid or Clomiphene in the UK, but obviously this can complicate aspects and they have their own issues and side effects. So TRT can be stopped at any point, but generally if it's stopped fairly early on, it's better in terms of getting your natural production back. That was the 10 points, but I'm just going to mention an extra point, number 11. TRT takes longer to work than you expect. So after 6 weeks, majority of patients are roughly in the higher levels of testosterone on the blood test, but not every patient will feel the symptomatic benefit. So why is that? The reason is they need to be at higher androgen levels for a longer period of time to get the benefits of TRT. So you need to be at high testosterone levels for 6 months, not for 6 weeks to feel the benefits. So once again, this is another part of expectation management with patients and making sure that they are expecting things will take longer rather than a couple of weeks. And that means that when the changes do happen, patients are pleasantly surprised rather than being disappointed that they haven't got the results they expected within a couple of weeks. So I hope that video has been helpful. So when we do TRT consultations at Men's Medical Clinic, these are some of the things that we run through. And it's important that whichever clinic you choose, these aspects are discussed with you and you've got the information you need to have a discussion with your doctor.